Well, good morning, everybody. Today we have Maggie Thielen. She is Maggie Thielen. She's a Climate and Health Program Manager. The Climate and Health Program is a CDC-funded program that seeks to understand how climate change impacts the health and well-being of people in Wisconsin. They aim to use what they learn to create strategies, tools, trainings for communities to adapt or mitigate the impacts of climate change. The Climate and Health Program is located within the Hazard Assessment section of the Bureau of Environmental and Occupational Health at DHS. And with that, I will turn it over to Maggie. Thank you.
Hi, everybody. I am excited to talk to you guys today a little bit about climate and health in Wisconsin. Um, as Brian introduced me, I am Maggie Thalen. I am the Climate and Health Program Manager with the Department of Health Services. And today, see if I get my slides to work. Today, I want to give you guys just a very brief overview of some of the climate and health impacts we are seeing right now in Wisconsin, focused around some of the extreme temperatures, extreme precipitation and flooding, as well as air quality impacts. Also want to provide you guys with some tools to assess and understand how climate change is impacting your community, as well as some lessons learned and potential avenues for taking public health action for climate and health. So, to go over, first, we need to understand what is happening in Wisconsin. Wisconsin is becoming warmer and wetter. This data is from the Wisconsin Initiative on Climate Change Impacts. There was a recent 2021 report that details the impacts from tourism to health to the Great Lakes to infrastructure. I recommend reading that to understand for a more holistic approach to understanding how climate change impacts health. But in all, Wisconsin is becoming warmer and wetter. As you can see here, significantly wetter in southern Wisconsin as over the past 50 some years. And significantly all over the state, our temperature has changed from 2 or 3 degrees over the same time period as the previous slide. However, Wisconsin's warming trend is not evenly distributed between the nighttime lows and daytimes. From season to season, nighttime temperatures and daytime temperatures, as we'll see in the next slide, have also been changing here. As you can see, as we're really experiencing now, those nighttime warming temperatures in winter especially have some of the most drastic changes, especially up in the northwestern part of the state. But significantly all around, we are seeing warmer nighttime temperatures. The one thing we do have to worry about with this nighttime temperature is that warming during the summer. Oftentimes, if we don't get a break from those significantly hot temperatures, our body can't recover enough at the nighttime. So we'll get a little bit more into extreme heat in a few slides, but wanted just to lay the groundwork for what is happening. We are also seeing those daytime warming temperatures here, as you can see. So the daytimes in summer are not getting hotter, but it is getting hotter in winter. It's kind of an interesting to look at all of these seasonal changes in Wisconsin. So, extreme heat in Wisconsin. I just want to go over a little bit of some of the impacts that we see. We see some direct and indirect impacts most frequently. Direct impacts, mortality and morbidity are oftentimes the ones that we are able to track the easiest. Heat-related illnesses, heat stroke, heat rash, as well as some like fainting incidents that are able to be tracked in a variety of different methods by the state. But also those indirect impacts. You think of those repeated continuous exposure to heat, your mental health might be impacted there. Also thinking about long-term heat events might result in power outages, as well as and all of the health impacts that are from there. People not who use electricity to live their daily lives are not able to in these power outages, especially if it's in a more rural area where they're not able to get electrical restored at a decent amount of time. Just some data to show that impact in Wisconsin. At the Health Department of Health Services, we try to track how many extreme heat related deaths are in Wisconsin. And here is an updated total over the past 23 years. If you guys remember, 2012 in Wisconsin was one of the hottest on record to rival some of the 1995 heat waves that came up. And but we've seen very variable amounts, but it's important to note that these numbers are probably underreported. It's underrepresentative. Heat can be a contributing factor to a lot of different other death-related causes, including some cardiovascular. Heat can exacerbate cardiovascular as well as different respiratory illnesses too. This is from an assessment done by the Environmental Public Health Tracking that looked at extreme heat-related emergency department visits over the years. And so again, you see that uptick in 2012 there, but there's been pretty there isn't a trend emerging, but you can see that we are seeing a lot of extreme heat-related emergency department visits that we're able to track. One of the more emerging issues that we've been seeing over the past year, especially, is that the impact of impaired air quality. With climate change, we are expected to see see more wildfires due to warming conditions and drought conditions all across the United States. We saw that this summer, where wildfire smoke from the Canadian wildfires brought high levels of particulate matter into the entirety of the Midwest, and trying to understand those impacts across the region is still ongoing. They've been able to do some studies of how much asthma and emergency department increases there were in eastern United States, but we're still trying to understand how our health was impacted this summer from this. It's also ground level ozone which is mostly uh, from related to smog and different types of other emissions is also a concern with especially with older cars or idling outside of areas where there's potential exposure uh, for those at-risk populations. Also, there is a lot of work being done to understand how allergens are changing with that changing climate, and where the seasons start and stop and how those are impacted here in Wisconsin. Just some pictures here of our impacts that we saw in June and July in Wisconsin. Well, not the Empire State Building, but I just thought this was a little bit dystopian and very interesting to see those impacts on such a large urban scale. But even looking in Milwaukee at the art museum, just not being able to see anything beyond those immediate people there. To really look at those exposures with air quality, we look at the air quality index that's developed through National Weather Service and based on some sensors from the Department of Natural Resources. Looking at Madison, Stevens Point, and Milwaukee, during that month between June and July, only 13 days were healthy on that healthy air quality index trend. And if you want to look at a more urban area, Milwaukee only had 3 days of healthy air quality impacts. So we're really working to try to assess what different health impacts that we can track to be able to see the full burden of the air quality, as well as what actions we can take to help communicate the risks and potentially adapt to the changes that we're seeing. Looking at extreme precipitation and flooding, again, a lot of direct and indirect impacts we are seeing. Direct impacts include drowning, injuries, looking at motor vehicle accidents, being able to see you're not able to get where you need to go, and trying to navigate all of those extreme precipitation and flooding damages immediately after a flood. It's also important to look a little bit at some of the indirect impacts that we do see from flooding. Again, mental health impacts are cross-cutting across most of the climate change related health impacts. But with flooding, you also have what happens during the cleanup and recovery, thinking about mold exposure, thinking about gastrointestinal diseases, and as well as respiratory from maybe the chemicals used to clean up the mold. You're looking at also at at rashes from being in the water or working with some of the or working in directly related to the cleanups. Uh, this is something I found really interesting just to show how much extreme weather and flooding and has really cost Wisconsin. Between 1980 and 2003, we had 58 confirmed weather climate disaster events losses exceeding $1 billion. Include drought, flooding, a freeze event, quite a few severe storms, and some winter storm events. Um, this is from the National Weather Service, and they estimate we about 2,710 people had died due to these events, as well as having all of those significant economic impacts there. Also important to note with this that the last 5 years accounted for almost 30% of these total disasters. So we are seeing these happen at a more frequent rate. To go over a little bit of some of the event injuries. This was just an assessment that I did post the flooding in 2018, looking at syndromic surveillance emergency department data, visits related to flood using a query from the Kansas Department of Health, I believe, and looking to see what are those direct and indirect health impacts that we are actually seeing reporting to the emergency departments, and quite a few were from had mental and behavioral health impacts. Not being Having repeated flooding is associated with some mental health impacts, and not being able to just have a clean home with the flooding damage is really significant. So all of these impacts, but how do we plan for them? How are we supposed to understand what's going on and take action from them? Luckily, the Climate and Health Program, as well as with a lot of very valuable partners, have worked to develop different tools and templates that a lot of local health departments and local partners are able to use to better understand their climate impacts and how to take action. In my introduction, we were really talking, said that the Climate and Health Program is CDC funded. We are funded through the Climate Ready States and Cities initiative, and we follow over the past few grant cycles, we have been following the what we call the BRACE framework. This is building resilience against climate effects. It is a 5-step framework that we use to really frame what we do and how we can hopefully help local health departments and our other local partners uh, build resilience in the face of climate change and really focus on those adaptation plans. What I want to go over is kind of how some of the tools we created really to anticipate those climate impacts and assess the different vulnerabilities in the state. Luckily, we've been able to really rely on a few different statewide initiatives to continue our understanding of how climate change is impacting Wisconsin. I mentioned the wiki report, the link is right there, as well as having the Governor's Task Force on Climate Change report that really kind of helps us frame an up to date action steps of what we can take as a state to address climate change. It's also important to look a little bit upstream on climate change and figure out how to prevent some of the fossil fuel impact and mitigate those actions from happening. So the Clean Energy Plan really lays out a really good framework for how we can mitigate the impacts of climate change. So, Wisconsin tools and resources for understanding those impacts, kind of going at that first step of the BRACE framework here. First, I'm going to talk about our flood resilience scorecard. The Flood Resilience Scorecard is a modular tool that communities can use to evaluate their resiliency to flooding and potential vulnerability through three different lenses: an institutional planning lens, environmental and agricultural lens, as well as a community lens. This tool we anticipate is very valuable in comprehensive planning and assessing programs over time. You're really able to use the data companion and those recommendations to uh, assess how your community is doing in regards to flooding and where you can take action. It provides some data driven recommendations to that you can really include in those grant applications and those hazard mitigation plans. Uh, we also this tool also brings together a wide variety of partners. We've had regional planning commissions complete this. We've had watershed groups complete this. We've had a city complete this. Counties look at this, and it's self-guided and it's meant to be conversational. So this is we're seeing a lot of really good feedback on this, and we would always like more people to complete the FRS as needed. Next up is our risk assessment flood tool. This has been around for a few years, so you guys might recognize this as it used to be called the Wisconsin Flood Resiliency Mapping Application. But we like the acronym RAFT a little bit better. We're buoying our way to flood preparedness and resiliency. So this tool is really used to, again, prepare and respond for flooding. It has a lot of different spatial data layers from state and federal agencies. It also includes the FEMA flood hazard layer throughout all of Wisconsin. This is formerly known as, I believe, the 100-year flood plain that FEMA has mapped out. And I can get the exact date that that this map is from, because I know there are a few counties where those FEMA hazard layers are changing probably. It also has a lot of live feed data you can get from the National Weather Service. Pull in those river flood gauges as well as those precipitation data as well and forecasts and warnings. There also is quite a few different analysis layers that you can use to look at potential vulnerability. The social vulnerability data is there. We also look at per capita within a floodplain, which is really interesting. And one of the most important aspects of this tool, I believe, is to be able to look at that critical infrastructure in relation to critical businesses and FEMA flood hazard layers. Are those potential for flooding? Where are the schools located? Where are the childcare facilities located? I had a local health department contact me that they wanted to be able to use this tool to assess the possibility of putting their licensed facilities on there to figure out where they should prioritize in the event of flooding. And you do have that capability with this tool. You have the ability to add in your own data and not mess up the entire tool. Here are just some screenshots of it. This is
Um,
around,
Maggie, this
yes,
is Brian.
yeah,
Sorry.
yeah,
Just for time purposes, we'll give about 5 more minutes and then maybe open for questions. I'm sorry.
sure. No, no problem. No problem. Feel free to look at the raft. There's a lot of different information on here. Here are just some screenshots of there, including some of the optional layers here that include some of those assessments that I mentioned. Also, we had developed a heat vulnerability index. This is a geospatial analysis of that heat vulnerability. There is a new web application platform coming soon to our website that you're going to be able to assess and look at and pull a little bit easier into existing plans instead of a PDF, a dated PDF. We also have developed quite a few different communication tools. These are our extreme weather toolkits that we had called, and they include a wide variety of topics and really talk about the preparedness for each of these climate impacts, fact sheets, as well as some potential talking points around this variety of topics from wildfires, harmful algal blooms, drought, vector-borne disease, etc. One other network that we are really working on building is a purple air network. You can see these are pretty cost-effective air monitoring tools that can be placed up anywhere, and DNR has a pretty good has a really good correction calculation to be able to monitor use these accurately, and they are already on a web application from Purple Air. We're hoping to be able to develop our own around a different project that the Climate and Health Program is involved in with Children's Health Alliance of Wisconsin in Milwaukee. Also, I need to plug our environmental public health tracking program, who is your source for environmental health data in Wisconsin. They have a really expansive data portal, and you really are able to see a lot of different information on climate and health, on different indices, and different types of environmental hazards and health outcome data. So, taking action. This is what you're here for. This is what the important part is. What a lot of the things we've found over the years is that collaboration is key. You need to find the people that are impacted and understand what they need to be to adapt to climate change. How can we prevent this information? How do we prevent these impacts on climate and health in this community? You need to be able to work across sectors to identify those different common goals and where you can incorporate health and where you can identify climate change related action steps. Uh, with public health and emergency management and planning, there's so many existing plans. We don't want to reinvent the wheel. Finding those that alignment among those common plans, I think, is our best bet to get climate change and health impacts included into strategic plans that we see across the state. Also leveraging that local knowledge, using the tools that I have talked about in previous slides, and being able to say, I understand why this census tract is more vulnerable to heat. I know that there is a community there that might need a different type of communication. And being able to use that in your response planning. Also, understanding the co-benefits of mitigation and adaptation. A lot of the climate and health, a lot of the climate change related funding is coming down, talking about infrastructure and mitigation and fossil fuels, and really being able to communicate the health benefits of this. Being able to say, if we implement this urban green, this urban tree canopy project, we are going to see an added health benefit, and we can use that health benefit discussion talking point to really make change and to have people understand that all of this leads to a healthier Wisconsin. And so I just put this in here before I take some of your questions of how, feel free to add this to the chat as you need to, how you can use these climate change tools in your work. I'm going to move on to our next slide for sake of time, but how we can use these. Just think about them as I kind of went through them. I know I went through a little fast, but we really think about that. Also, the Climate and Health Program is doing some message testing on understanding what climate and health messages motivate you as a person in Wisconsin. And so I believe my coworker Kate is going to be putting in the links to these, but here if you want to screenshot the QR codes, we have this available in English and in Spanish. Thank you. Apologies for going long. I will take questions.
I'm not seeing any questions in chat. If anyone has questions, go ahead and come off mute and ask away. And thank you for putting all those links in the chat for us. No questions? What?
Does anybody have like a suggestion of how to use those tools, or have you used any of the tools that I previously talked about um, in your work? Uh, Is the HVI in your heat response plan? Is it um, in the hazard mitigation plan? Is it? I guess that would also be something we'd be interested in.
I have not, and actually, this is the first I've heard of some of these.
Okay.
So this is good. I think some of us will probably go back and look through some of these, especially flood tools, because that impacts a lot of our facilities that we deal with and license.
Yeah, the risk assessment flood tool I use for more than just flood planning. I'm on call for chemical and natural disasters as well as for our bureau, and I use that for when there's potential spills or other things because we're able to have where we pull in data from the DNR private well database, and you're able to see where potential private well impacts are in that area. So it has a lot of different uses besides just flood planning.
Well, I'm not seeing any other questions. I guess we'll wrap it up. And thank you very much for presenting.
Yeah. And if anybody has any questions on the different tools or toolkits or or you just want to know more information on the climate and health program, please reach out. We have a wealth of knowledge among us. So looking forward to chatting if anybody would like to.
Well, thank you very much.